Ankle muscles first group. Superficial posterior gastrocnemius. It has a divided origin in two portions. The medial in the posterior region of the medial condyle of the femur and the lateral in the posterior region of the lateral condyle of the femur. It is inserted in the posterior region of the calcaneus. It is innervated by the tibial nerve and has action on plantar flexion of the TT and fluid of the knee. Solio. It originates from the posterior tibia and fibula. It is inserted in the posterior calcaneal region. Tibial nerve. Plantar FL function. Plantar originates in the posterior lateral condyle of the femur. Inserted in the posterior calcaneus, end tibial F. Plantar flexion. Second group. Deep posterior tibial originates in the tibia, fibula and interosseous membrane, is inserted in the tarsal and metatarsal bones, especially the navicular bone. It is innervated by the tibial and performs plantar inversion and plantar flexion. Flexor digitorum longus originates in the posterior region of the tibia, and is inserted in the distal phalanx of the toes, innervated by the tibial nerve and performs flexion of the toes and helps in plantar flexion. Flexor hallucis longus. It originates in the posterior region of the tibia and interosseous membrane. Phalanx, flexes the hallux, assists in inversion and plantar flexion. Nerve, tibial nerve. Third group. Anterior. Tibialis anterior originates in the lateral region of the tibia and interosseous membrane, inserted in the cuneiform and metatarsal bones, is innervated by the deep peroneal nerve and performs dorsiflexion and inversion. Extensor digitorum longus. It originates in the tibia, fibula and interosseous membrane and is inserted in the distal phalanx of the second to fifth toe. It is innervated by the deep peroneal nerve and performs the extension of these four toes. Extensor hallux longus. It originates in the fibula and interosseous membrane and is inserted in the distal phalanx of the hallux. It is innervated by the deep peroneal nerve and performs the extension of the hallux and helps in dorsiflexion. Fourth group. Lateral. Fibularis longus originates from the proximal extremity of the lateral fibula in the interosseous membrane. Insertion in the plantar surface of the first metatarsal and cuneiform. Performs eversion and helps plantar flexion. Superficial peroneal nerve. Fibularis brevis originates at the distal part of the fibula, insertion at the base of the fifth metatarsal. Performs eversion and assists plantar flexion. Innervation by the superficial peroneal nerve. Medial distal fibular origin, insertion at the base of the fifth metatarsal, innervated by the deep peroneal nerve. Assists eversion and dorsiflexion. Pelvis versus hip. The pelvis and the hip are two different, but fully interdependent, skeletal parts located in the lower part of the human body. Several bones are arranged to form these strong bony parts, including the pelvis. The pelvis and hip are very important because they provide rigid support to the body by connecting the lower and upper bones and serve as the basis for movement of the other parts of the anatomy. In addition, these two bones stabilize the body by distributing the weight of the upper body evenly. Pelvis. The pelvis is a large semicircular bone complex composed of three bones arranged in a ring, namely, ilium, ischium and pubis. The ilium is a wing-shaped bone that rises on each side of the pelvis. The ischium forms the central part while the pubis forms the base of the pelvic structure. The pelvis is connected to the upper skeleton by the sacroiliac joint, which is fused at the connection between the pelvic bones and the lower spine. The primary function of the pelvis is to facilitate back and leg movement. In addition, it is useful to evenly distribute all the weight of the upper body between the legs, which are connected to the pelvis by the hip joints. The pelvis also protects the internal organs of the lower abdomen. Hip joint. The hip joint forms a ball and socket between the pelvis and the femur. The head-shaped ball of the femur fits into the acetabulum. The cup-shaped parts of the pelvis are formed together to form this joint. There is a ligament that connects the femur to the acetabulum across the space between the two bony surfaces and stabilizes the joint as the bones move. What is the difference between pelvis and hip? The hip joint is a ball and socket joint between the pelvis and the femur, while the pelvis is a large bony structure located in the lower part of the body. The hip joint connects the pelvis and the femur, while the pelvis connects the spine and the legs. The pelvis distributes the weight of the upper body to the legs through the hip joints. There is only one pelvis and two hip joints in the human body.